Bonjour and welcome back to the second portion of the media briefing for today for the technical briefing on the vaccine rollout. Bonjour et bienvenue à cette deuxième partie de la mise à jour des médias avec la briefing technique sur la distribution des vaccins côté logistique. Today we will hear from Dr. Howard New from the Public Health Agency of Canada, as well as Major General Danny Fortin. They will be accompanied by Dr. Supriya Sharma and Dr. Marc Berthiaume, as well as spokespeople and experts from Public Services and Procurement Canada, Indigenous Services Canada, as well as Innovation, Science and Economic Development Canada, to answer your questions until 2 p.m. Donc, aujourd'hui, nous allons entendre parler de Dr. Howard New de l'Agence de la santé publique du Canada, ainsi que Major général Danny Fortin. Ils seront accompagnés de Dr. Supriya Sharma et de Dr. Marc Berthiaume de Santé Canada et d'experts en la matière de Services publics et Approvisionnement Canada et d'autres ministères et agences fédérales. Donc, over to you, Dr. New.
Thank you very much, Eric. Merci beaucoup. Good afternoon, good morning, everyone. Thank you for being here. The purpose of today's briefing is to update you on our readiness to begin vaccinating Canadians against COVID-19. Once again, I'm joined by my colleague, Major General Danny Fortin, Vice President of Logistics and Operations for COVID-19 Immunization in Canada. And with us to answer technical questions as appropriate are Ariane Reza, the Assistant Deputy Minister of Procurement at Public Services and Procurement Canada, Dr. Supriya Sharma, the Chief Medical Advisor at Health Canada, Dr. Marc Berthiaume, Director of Bureau of Medical Sciences at Health Canada, Cheryl Kronewek, Director General of Manufacturing and Life Sciences Branch, Innovation, Science and Economic Development Canada, Colette Kaminski, Director General, Strategic Innovation Fund, Innovation, Science and Economic Development Canada, and Dr. Tom Wong, Executive Director and Chief Medical Officer of Public Health at Indigenous Services Canada. Collectively, we aim to answer your questions and provide you with an understanding of where we are at with our COVID-19 vaccine readiness. This includes distribution, timing, engagement with provinces and territories, and contingency planning. I can tell you that it's all hands on deck right now, and everyone is working full throttle. The pandemic has impacted our lives in profound and extremely challenging ways. We have all been eager for a sign of hope. As you know, the Government of Canada has announced that we now have an agreement that will see us receive up to 200 authorized COVID-19 vaccine through Health Canada's rigorous testing and regulatory process. At last, we have a reason to feel optimistic and excited about returning to the lives we led pre-COVID. The latest agreement is bringing vaccines to Canadians earlier than we hoped. Things are happening quickly. By the time the initial doses of the first vaccine doses are delivered, we will have completed the first step toward making COVID-19 vaccines available to every Canadian from whom it has been authorized and recommended. The Public Health Agency of Canada is engaging with all levels of industry, government, and health agencies to ensure 14 sites across the country are ready to receive the Pfizer-BioNTech vaccines by next week. In the next few days, we will be working very closely with the provinces and territories and many public health partners to ensure there is timely, fair, and a well-coordinated rollout. Part of this collaboration involves making sure we can receive, store, prepare, and administer the ultra-low temperature vaccine. As we work to reach these goals, we will rigorously maintain our ongoing commitment to providing Canadians with access to safe and effective vaccines. Canada has a high standard that it will not relinquish. As you know, Public Services and Procurement Canada has negotiated agreements with 7 vaccine manufacturers, so it is a matter of time before we embark on the track for more extensive immunization in this country. COVID-19 vaccine candidates will be distributed in Canada with a phased approach beginning in 2021. More details on vaccine allocation will be announced in the coming days. In the early stages of the rollout, supply will be limited. The quantity and schedule of vaccine distribution will be the subject of ongoing discussion for 3 million Canadians between January and March, with supply ramping up over the rest of 2021. This has been a marathon, and we are nearing the finish line. It's essential that we not let our guard down now and continue adhering to public health measures now and as necessary, even after we have vaccines in arms. Thank you. Bonjour à toutes et à tous. Je vous remercie.
Good day, everyone. I want to thank you for your attendance. This information session, its purpose is to give you an update as to the state of readiness for the vaccine. I am here with my colleague, Major General Denis Fortin, Vice President of Logistics and Operations for vaccinations against COVID-19. Also here for technical question, Ariane Reza, Assistant Deputy Minister at Public Service and Procurement Canada, Dr. Supriya Sharma, Chief Medical Advisor for Health Canada, Dr. Marc Berthiaume, Director, Bureau of Medical Sciences at Health Canada, Cheryl Cronaway, Director General Manufacturing and Life Sciences Branch at Innovation Science and Economic Development Canada, Colette Kaminski, Director General, Strategic Innovation Fund, Innovation Science and Economic Development Canada, and Dr. Tom Wong, Executive Director and Chief Medical Officer of Public Health Indigenous Services Canada. Our common goal is to answer your questions and allow you to understand where we are at in our preparations for vaccinating Canadians against COVID-19. This covers the issues of distribution, the timing of vaccination, the engagement with the provinces and territories, and contingency planning. I can assure you that all stakeholders are working round the clock at this point. The pandemic has deeply impacted our lives, has meant huge challenges. We have all been anticipating with great hope this important time, this important moment. We now have 249,000 doses that will be made available of the Pfizer-BioNTech vaccine in December 2020. We now have the first authorized vaccine authorized by Health Canada. We finally have reason to feel optimistic and enthusiastic. We can see that there will be light at the end of the tunnel and that we will be able to go back to the lives we once had. The situation is evolving quickly. Before the first doses are delivered, we will have gone past this first step, and we will be able to give Canadians who have received the authorization and recommendation to be vaccinated, will be able to vaccinate these individuals. All governments, all health organizations will make sure that the centers that have been set aside throughout the country will be able to receive the doses of the Pfizer-BioNTech vaccine by next week. We will be working closely with provinces and territories as well as with the many healthcare partners in order to guarantee a quick implementation that is fair and well coordinated. This collaboration involves ensuring that we can receive, prepare and administer this vaccine that has to be maintained at an ultra-low temperature. In keeping with our efforts, we will continue to rigorously respect our permanent commitment to giving Canadians safe and effective vaccines. Canada has high, rigorous standards that it is not going to compromise on. As you know, PSPC has negotiated agreements with several manufacturers. It is just a matter of time before we can more broadly vaccinate Canadians through the country. Other vaccine candidates will be gradually distributed and rolled out through Canada throughout the year 2021. Supply will be limited during the first stages of rollout. The quantity of vaccines, the distribution, timing, all of this will be the subject of ongoing discussions with the provinces and territories. That said, the availability of vaccines will increase gradually over the coming year. In the first quarter of 2021, in other words, between January and March, Canada expects that it will receive enough authorized vaccines for 3 million Canadians. We are running a marathon, and now we can see the finish line. That being said, we need to remain vigilant and continue to respect the public health care measures even after we've been vaccinated. I'd like to now hand over the floor to Major General Fortin, who will be telling you about the logistics and operational planning related to the most recent developments and the vaccination and issues as to the vaccination against COVID-19 in general.
To put in place a plan that will allow us to deliver vaccines safely and efficiently to as many Canadians as possible and as quickly as possible. We're undertaking a mobilization effort of massive proportion. Never in modern memory have we seen such an unprecedented level of collaboration and cooperation. It really makes me proud to be a Canadian and proud to serve. Our collective efforts to enhance readiness, to build capacity, and to develop innovative ways to deliver vaccines has enabled the vaccination distribution process to move ahead so that we can start to deliver vaccines to priority populations within days. We continue to forge important relationships with provinces, territories, Indigenous leaders, other government departments and partners, relationships that will allow us to come together in common purpose and to adapt to the complexity of the situation and rapidly evolving circumstances. Together, we've built and tested logistical chains suited to the individual characteristics of the vaccine. Provinces have indicated their initial locations, for a total of 14 across the country, are ready to receive the vaccines. To prepare for the imminent arrival of Pfizer vaccines, a dry run was conducted this week to confirm our ordering, the shipping, and receiving processes. Concurrently, the provinces and territories have been building their plans for distribution of vaccines within their jurisdictions and ensuring that all ancillary equipment, the training, the safety monitoring system are in place to support the rollout. As an example, devices such as this one here, the data logger that accompanies every single thermal shippers from manufacturer to the point of use, at which time it is unpacked and the data verified. And if there's a point of exclusion on the temperature reader, then steps are we follow the appropriate steps to isolate the shipment and then confirm with Health Canada whether or not they should be quarantined and disposed of. Provinces and territories alike are readying to receive the Moderna vaccine as soon as it is authorized and available. The logistics service provider contracts have been awarded. The distribution networks are in place for all of Canada's anticipated COVID-19 vaccines. On Friday this week, we'll conduct a rehearsal of concept with more than 100 participants from federal, provincial, territorial governments, Indigenous and industry partners, and key stakeholders. The rehearsal will allow each organization and entity to visualize their role in the vaccine distribution process, to confirm responsibilities, the critical handoffs, and plan. This effort will be coordinated by the National Operations Center at the Public Health Agency, this coordination hub that keeps us all on the same page, maintaining situational awareness on the entire end-to-end process with provinces and territories, ready to respond on a moment's notice to ensure the integrity of the distribution chain. This deliberate approach to federal, provincial readiness will allow us to gather lessons and to test and adjust as we move forward into the January and beyond period. As we roll into spring and summer, we anticipate a steep increase in vaccine availability. Distribution will also become easier as additional vaccines are approved, and that can be transported outside of the ultra-low temperature and frozen cold chains. We'll be ready to deliver through any eventuality as vaccines become more and more available to Canadians. The safe and efficient rollout of Canada's COVID-19 immunization campaign is our primary focus, and rest assured, security is a key consideration in the planning and the execution of the vaccine rollout. The government is seized with the task of ensuring timely and effective distribution for the full suite of anticipated vaccines. Our collective efforts over the past weeks and months the rehearsal of our distribution and logistics systems that are currently underway, and the upcoming launch of Pfizer vaccines at designated sites all serve to set the conditions for a rapid scale-up as vaccines become more readily available in the months ahead. With that, thank you, and I welcome your questions. Nous avons travaillé d'arrache-pied.
We've worked tirelessly to create a plan that will allow us to administer vaccines in an effective, safe way to the largest number of Canadians possible, as quickly as possible. We have launched a large-scale mobilization process. In recent memory, we've never seen this level of cooperation among all levels of government, etc. It makes me very proud as a Canadian. It makes me very proud to serve. Our collective efforts to increase preparation, increase capacity, and have innovative ways to administer vaccines have led to the fact that the distribution process has been advanced. We will be prepared to administer the vaccine to the priority groups in the next few days. We continue to establish strong relations with the provinces and territories, Indigenous representatives, other departments, and our partners. We can combine our strengths to work together and adapt to the complexity of the situation and the quick evolution of the circumstances. Together, we have developed and tested logistical chains that are in keeping with the various characteristics of the vaccines. By Monday, in Canada, there are 14 locations in Canada that will be ready to receive and administer the vaccines throughout the country. A dry one was done this week, and I referred to it earlier, to validate our ordering, shipping, and receiving process before the imminent arrival of the Pfizer vaccine. At the same time, the provinces and territories will have created their own distribution plan for the vaccine, allowing for the equipment, the training of healthcare providers, and proper monitoring of the systems in order to facilitate the deployment. As I showed you when I was speaking in English, there's a data logger that I'm holding in my hand here that will be accompanying each box of vaccines when it is unpacked at the distribution point. From the very beginning of the process to the very end point, we can measure the temperature at each step and maintain integrity of each shipment. The provinces and territories are readying for the Moderna vaccine as soon as it is available. There have been service provider contracts with logistics services. Logistics plans are in place. On Friday, we will be doing a rehearsal of concept with over 100 participants, the federal government, provincial governments, territorial governments, and key stakeholders will all be involved. Each organization, each entity will know what its role is in the rollout of the vaccine. It will confirm the responsibilities of each, critical handoffs, ensure everyone has a common understanding, and make sure that the conduct and execution of this complex plan is in good working order. The National Coordination Centre at the Public Health Agency of Canada is the organization responsible for coordinating this effort. This coordination centre allows us to be very united in our process. We are, and our other stakeholders, we are prepared to act at any moment in order to protect the integrity of the distribution chain from end to end. We will be able to garner lessons from this. We will be able also to make the necessary adjustments over the coming months. We expect that the vaccinations become more accessible in the spring and the summer. Distribution will be increased in terms of through these simpler supply chains that do not require ultra-low temperature frozen distribution. We will be prepared for anything as we prepare the rollout. A safe vaccination campaign is our main objective. Rest assured that security, safety is a critical aspect of the planning and execution of the vaccine. The government is responsible for ensuring that all of this is done. All of our efforts over the last few months, the current trials, our distribution systems, logistics, and now the launch of the Pfizer vaccine in these designated institutions will pave the way for quick approval of the vaccines that will become more available over the coming months. Thank you very much for your time. And on that note, I am now prepared to answer your questions. Thank you.
Merci beaucoup. Thank you. We will now open the telephone line to questions. We will take questions until 2 p.m. Just like in the first round, we'll take 2 questions on the phone, followed by 2 questions in the room. Donc, comme la première fois, nous allons commencer, vous allons prendre vos questions jusqu'à 14 heures.
I'll be taking your questions until 2, and then we'll start with 2 questions over the phone, 2 questions in the room.
Follow-up, une question suivie. For those who are asking questions in the room, please make your way to the freestanding mic. We'll start on the phone. Operator, over to you.
Thank you. Please press star 1 at this time if you have a question. There will be a brief pause while participants register for questions. Thank you for your patience. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Il y aura un court délai permettant de vous enregistrer dans la file d'attente pour la période de questions. Merci de patienter. Our first question, la première question, Guillaume Saint-Pierre, Journal de Montréal. Your line is open. À vous la parole.
Oui.
Question. Yes, hello. François Legault said earlier on today that he, inaudible to the interpreter, the hope was to receive a third of the doses, inaudible. Do you think this is realistic? Answer, thank you for the question. This is Dr. New. Perhaps I can start, and then perhaps Major General Fortin will be able to add more. What I can say to you is this. We, technically speaking here at Public Health Canada, we are working closely. And we're constantly in discussions with respect to that Senior Advisory Council with Dr. Arruda and other experts in public health, other experts from Quebec, as to how these doses will be attributed. I think I can start by saying that it is really important, given our discussions, I myself can say that I am a part of the healthcare table. Major General Fortin, of course, discusses with his counterparts on the operations and logistics side from the other tables. There will be another discussion among the premiers. I think that is happening tomorrow. So there will be further discussions. We, at the Special Advisory Committee, discuss this issue of attribution. Ultimately, the recommendations of the public health authorities is that the attribution will be done based on population, so on the number per capita, basically, throughout the provinces. Of course, there are discussions ongoing. Perhaps one province has more seniors, one province, may have fewer. But at the end of the day, it's fine that everyone agrees, I think, that we should begin per capita. Now, another consideration is who the priority groups are. That's another issue. We are currently discussing this as to the priority populations. What I can say is that we have discussed the question, and we are looking at a distribution per population from the public health perspective. Hello, this is General Fortin. I can add that from now until end of March, we expect that we will be distributing up to 6 million doses of approved vaccines. That will be done in the context of a national rollout. I think the provinces can expect that they will be receiving a portion of that will be attributed to each one province and territory. The rollout nationally for each product is yet to be confirmed. We are having discussions on a daily basis, multiple times a day, I would even say, with Pfizer today to set up a distribution plan. We have some visibility on the overall amount, the distribution, and at what time, what the timing of the arrival of these doses will be, and all of that is something that we are considering. Follow-up? Thank you, that was clear. Next week, Quebec in intends to vaccinate people in long-term care homes. Pfizer is inaudible to the interpreter. You've identified 14 sites. Inaudible to the interpreter. Something about the sites and whether that will be available. Answer. The 2 sites have been announced by the province of Quebec. Those 2 sites announced by Quebec are part of the 14 sites nationally that have been announced. Thank you. Next question, operator.
Thank you. Our next question, Dylan Robertson, Winnipeg Free Press. Votre ligne est ouverte. Please go ahead.
Hi there. The Manitoba Premier says Ottawa increased the province's vaccine quota by boosting 15% of the Moderna quota to account for Indigenous communities. I wanted to know if that's accurate, what other changes you have done for provinces with their quotas, and if there's any specific parameters for protecting Indigenous people other than the vague outlines in the vaccine plan.
Thank you for the question. It's Dr. Maybe I'll start and maybe I'll back up a bit. As I was saying in French, that certainly one point I want to make is that there's a very tight, I would say, collaboration that's obviously necessary between, quote, the public health and the logistics side of the house. So that's why Major General Danny Fortin and myself and our respective teams are working very closely together. I can only comment on the tables that I sit at. You know, there's lots of, I would call, federal, provincial, territorial tables or FPT tables. I can talk about the public health table, the special advisory committee on which Dr. Tam and myself and our counterparts, the chief medical officers of health, we have very active discussions. So I'll speak to that. And as everyone knows, there's also a First Minister's meeting that will be taking place tomorrow. So there will obviously be other discussions as well. At the SAC table, what we've discussed in terms of the principles moving forward is that we've agreed from a public health perspective that we will go with our per capita formula for distribution allocation of vaccines to each of the provinces and territories. It's for certain we've had active discussion. People could quibble and say, well, look at this. I think if I look at the census data, I've got more seniors, older people in my province, or maybe I've got a greater number of healthcare workers. But at the end of the day, I think it all evens out, and I think we're all agreed that we're going with a per capita sort of allocation. Then the next point I think that you're referring to is that we take very seriously the recommendations have come from our National Advisory Committee on Immunization, NACI, and you can see that recently they've come out with sort of 4 priority groups. So if we're looking at sort of the fact that there is a limited number of doses of vaccine available in the first quarter of 2021, the groups that should be looked at in terms of priority, obviously because they're at greater risk of either becoming infected, having more severe consequences, but also maybe transmitting to others who are more vulnerable. Those would be older Canadians, starting with those greater than 80 years of age, and then maybe as circumstances permit, maybe going to a younger group, greater than 70 years of age. Residents and staff in long-term care facilities, healthcare workers, especially those who provide direct patient care, and Indigenous communities. So that's the principles, and now we get to the reality. And this is where the interface between public health and logistics becomes very important. So the 2 vaccines that we've been planning for, and the planning obviously at the SAC table, was taking place even in advance of having any approved vaccines. So where we're looking at the Pfizer vaccine and the Moderna vaccine. So now we have today, congratulations to our colleague at Health Canada, we now have 1 approved vaccine. But our planning still continues with respect to having potentially both Pfizer and the Moderna vaccine in hand. So one thing I think that we've already shared is that looking at the sort of the logistics, the fact that the Pfizer vaccine obviously is much more challenging in terms of the cold chain requirements, ultra cold chain. The discussions we've had at the SAC table have led to a consensus decision that it doesn't make practical sense to use the Pfizer vaccine in the territories up north. And therefore, their request was that, yes, maybe they'll sit out. They won't sort of expect to receive the Pfizer vaccine, but they would like the Moderna vaccine. So here we go in terms of, I think, good FPD collaboration. If we're expecting around 6 million doses total of the 2 vaccines in the first quarter of 2021, there was agreement that the territories, in terms of their allocation, will receive exclusively the Moderna vaccine, or maybe other vaccines that are approved, but obviously not as stringent in terms of logistical requirements like the Pfizer vaccine. And I think to the credit, the provinces have then agreed to yes, if we're agreeing to send all of the Moderna vaccine to the territories because of the unique circumstances in the north, then we will sort of reallocate and take a greater share of, quote, the Pfizer vaccine available so that the Moderna vaccine can be obviously given to the territory. So you can see those are the kind of active discussions we're having. So then we move on to sort of the next part in terms of the Pfizer vaccine and the very stringent requirements and the point of what we call utilization, the 14 sites and so on. I think at a very practical level, and I can't speak for the provinces and territories, there's some very, I think, intense discussion and planning going on. Because even if you look at sort of the allocation, the Pfizer vaccine will not come all at once. It will come in sort of regular shipments. So as you receive your first 1,000 doses, who do you give it to? You look at the 4 groups. In a given province, you might even make a decision between priority populations. For example, certainly the government of Quebec, for reasons I can fully understand, say they would like to have their first doses delivered in long-term care facilities. I think we can get that. In another province, maybe they would say that, with our planning and factors being considered, we would like to vaccinate our healthcare workers level. Then you take it down to a very practical level. Okay, if you're going to vaccinate healthcare workers, well, where do you start? All healthcare workers who deliver healthcare, you might have it be easier, more feasible to do it maybe starting off at a facility in an urban setting. Not to say that healthcare workers who provide healthcare, direct healthcare in a more remote or rural setting are not as important, but in terms of the feasibility, the sequencing, those are all factors that need to be considered. Because the final point I'll make is that it's been a point of discussion at the SAC. What is the difference really in practical terms between a community in the territories up north that is quite south and close to the border with a province that also might have a community that's in the northern part of their jurisdiction? It's sort of a political jurisdictional border, but at the end of the day, those two communities, in terms of the geographical reality of what they're dealing with, is the same. So I think I'll leave it at that. Thank you very much.
Thank you, Dr. New, for that very detailed response. Follow-up, Dylan?
Okay, so I'm still left wondering here about the quota shifting for provinces for Indigenous communities. Dr. New is saying that it's per capita, but the Manitoba Premier said 15% extra to account for Indigenous communities in the first quarter. So I don't really have clarity there. I'm wondering if Major General Feltin or someone could speak to that. And my follow-up is, Ottawa has a fiduciary duty to First Nations, but you're actually asking provinces to prioritize Indigenous people without any hard parameters. Is that correct? And, is Ottawa worried that they're going to be found to not be holding up their constitutional duty to look after First Nations?
It's actually, maybe I'll answer the first part in terms of, you say, fiduciary responsibility. Certainly, I think Indigenous peoples, I think from a scientific perspective, we recognize are at increased risk. So I think from the public health perspective, we're all on the same page in terms of recognizing their priority group for vaccination. I think we've had very good discussions, and certainly my understanding is that when it comes to really delivery of vaccination within the individual provinces and territories, there's been great work, collaboration that's obviously evolved over the years, so that within the existing systems for delivery of vaccination to various populations, including Indigenous within the provinces and territories, that's, I think, established very well to various degrees in the provinces and territories. And certainly, I think the anticipation is that that would continue even as we give the vaccines to the provinces and territories in terms of how they've always rolled out vaccinations for their populations, including Indigenous populations. Certainly, I think that there are maybe other considerations in terms of specific communities, but I think as a general principle, I think it's a shared, responsibility in terms of a good collaboration between the federal government and provinces and territories.
General Fortin, I would only add that we're very much aware of how complicated it is to distribute vaccines with very stringent requirements across the Canadian landscape, with the population distribution that we have in winter. So there's a level of complexity there that's a masterclass in itself. The other piece is some vaccines will become easier over time, easier to handle and to distribute over time as we get more stability data. But also important is to highlight, as I've indicated earlier, highlight the fact that stakeholders come together and have discussions. Indigenous leaders are part of those discussions. ISC, in close coordination with us, we're focusing on how we can, prepare ourselves for that complicated distribution on reserves, in close coordination with provinces and territories. In provinces, the territories, they are very resilient, and they've started to identify some possible friction points in terms of delivery that we're all together looking at. But in terms of the distribution at scale, that's the result of, as I mentioned before, a whole nation effort. All those different perspectives are being factored in. We, of course, don't have all the answers today on this, but we're very much aware of that, and we continue to pay attention to that every day. Oui. Alors, oui.
Yeah, so I have to do this all over again. So the rollout of the vaccines that have these specific requirements, such as ultra low temperature, when you think of the country, the size and the distribution of the population throughout the country in the wintertime, it involves a number of challenges, as I've said. This is a masterclass in and of itself, as I said, in English. Good luck saying that in French. Clearly, with our partners, we are having discussions with the various orders of government, Indigenous services, that is working closely with us on this. So we don't have all the answers today on distribution in those areas that require particular attention, but we're working at addressing these issues with the provinces and the various orders of government, the various federal departments.
To the Dr. Tom Wong, who is obviously the Chief Medical Officer of Public Health and Indigenous Services Canada, for any additional comments he would like to make.
Question. It is important that First Nations, Métis, Inuit are being invited to sit at the table with provinces and territories in order to co-develop a deployment plan together. It's only, with walking together down the same path, then that we can achieve the greatest accomplishments. So with that, the federal government has been identifying the mechanism for doing that, including convening a federal, provincial, territorial, First Nations, Métis, and Inuit vaccine planning working group, inviting all the provinces and territories together with our First Nations, Métis, and Inuit partners, including urban Indigenous partners and Indigenous Physicians Association, Indigenous Nurses Association, to come to the same table to actually discuss about the rollout plan. And this is at the national level, but we would want to facilitate and promote and advocate for that to be replicated, in each province and territory. Thank you so much.
Thank you, Dr. Wong. We will now move to the room for 2 questions. We'll start with CTV.
Hi, Dr. Nguyen, Major General Fortin, Mackenzie Gray with CTV News. Quebec has said that they are expecting their first shipment of vaccines to arrive, I think, on Monday. Saskatchewan thinks they're getting it on Tuesday. Is that accurate with the timeline that you expect is going to happen? And can you take us through the process when they leave Belgium? Where are they going to land in Canada? Can you just take us through that?
So we expect vaccines to be shipped very soon, by the end of the week. I think this is Wednesday afternoon. The Pfizer indicated that they would be prepared to ship by Friday. So assuming Friday, we could see vaccines arrive Monday, probably Tuesday. We'll know more as we move forward in the next 36 hours. We just don't have that fidelity just yet. But now that Pfizer knows that the vaccine is approved, they can actually push a button on moving forward on that plan. So we'll follow that very closely, and we'll be able to and provinces will be able to see when those vaccines arrive at destination. As we executed the dry run this week, we identified that from the moment that the thermal shippers were shipped from Belgium, 36 hours later, the first one started to arrive, and they have all arrived but one box that arrives tomorrow, I believe in the morning. So this is very much as when you order stuff online that comes from overseas. You have an ability to track, and things arrive, and of course this is closely followed, and this was part of the dry run. Really identify those elements, those points of transfer, and if the whole thing works according to plan. And so far, everything proved to work very well. Oui, alors les vaccins, on s'attend à ce que...
So we expect Pfizer to be able to send the vaccines from Belgium to Canada. They will be leaving on Friday. We can expect that they will arrive here Monday or the early next week. To get back to the exercise that we engaged in this week, we could see that from the time the boxes were put on a plane, it took 36 hours for the boxes to arrive. I think the second box should arrive tomorrow morning, so it should only take a few days. Thank you.
I know the provinces have a stake in this question, but just kind of hypothetically or generally, Major Fortin, is the expectation that vaccinations will take place at the airport, let's say, or will they be able to, the vaccines be able to be transported to hospitals? I know in the UK they're doing them at hospitals right now. And you've mentioned the 14 sites. Can you tell us where those 14 sites are?
So Pfizer will bring, with their third-party logistics provider, they will bring the vaccines to the points of use, to the 14 initial points of use. That is where the vaccines will be administered. Moving forward, as we learn more about the vaccine and the ability to transport it frozen, unfrozen, and so on, we'll be able to explore other options, and more points of use will be added to this. Provinces have identified those locations. Provinces and territories have identified locations for Moderna, and that's all being compiled and looked at right now. So as we have more visibility on the flow, we'll turn on additional points of use in the provinces. Really, the provinces are driving that process in close coordination with us. No, it's at medical facilities.
Thank you. Next question, Globe and Mail.
Hi, Marika Walsh with the Globe Mail. To Mackenzie's question on Saskatchewan saying December 15th, can you confirm whether Canadians will get their shots as of December 15th? That's when the first shots will happen?
Well, we expect vaccines to arrive maybe as early as Monday. And it takes time to prepare the vaccine. As I explained in other engagements, I indicated you need to thaw, you need to mix, decant, and they have all that they require to execute this process, and they have the knowledge as well to do it by now. So it's totally possible that as early as midweek next week, maybe even the 15th, depending on when we receive them. But I'd be speculating at this point because we haven't seen boxes with vaccines depart the facility. So as we get more, we'll be able to get more clarity on this.
Follow-up. Oh, Français?
Français, alors c'est entièrement possible.
So it is entirely possible that midweek next week, that in some areas we'll be able to administer the vaccine, given the fact that we expect to receive, or we can expect to receive the vaccines as of Monday. Thank you.
Term plan shows that the general population will get vaccinated between April and December, with most people getting vaccinated between April and June. How are you going to make sure this isn't like the Hunger Games of vaccines? How are you going to actually make sure that there's some sort of organized rollout? How will people get in line and ensure that it happens?
Okay, Dr. New, maybe I'll start with that. Thank you very much for the question. As we've indicated, certainly the first vaccine out of the pipeline is the Pfizer vaccine, and certainly we anticipate receiving, I think, 4 million doses or so in sort of the first quarter of 2021. And of course, we anticipate having regulatory approval, hopefully, for the Moderna vaccine, and also, if that's the case, I think at this point, my understanding is with the planning is for 2 million doses as well, so the 6 million doses in total for 2021. Then for the first quarter, for the first quarter, sorry. That's right. So with that, what NACI has given us is that even before preliminary guidance in terms of the quote, the priority groups in general, healthcare workers, essential workers, and so on, what they've given us more recently is more focused advice in terms of the sequencing for priority populations, even at a more granular level, focusing on what we might expect in sort of the first quarter. However, what we're anticipating is that we have agreements with 7 vaccine manufacturers in total, and if all goes well with any additional ones, obviously there's 2 others are also have submitted applications to Health Canada. We'll have a suite of vaccines, of approved vaccines, and of course with our advanced purchase agreements, we anticipate getting many millions more of doses. And so I think Major General Fortin can speak to it as the sort of the experience accumulates, the comfort level in terms of the vaccination sites and administering the vaccine to Canadians. We anticipate that the provinces also will be able to organize more sites of vaccination, maybe with a different sort of a combination of vaccines. And certainly some of the other vaccines that we anticipate getting approval will be much easier to, I would say, handle, manipulate, and administer compared to the Pfizer vaccine. And so I don't anticipate there should be any issue problem in terms of offering a wider and growing number of Canadians vaccines starting from April on. Anything to add?
Perhaps I would just add, provinces and territories have been administering vaccines. They're in charge of the immunization plan. Those vaccines are very different. So there's a level of cooperation, of course, that is required to ensure that we do this as effectively, as rapidly, and as safely as possible on a national scale, at a scale and quantities that we have never seen before. But we must not forget that people actually do know how to do this. So it will be with medical professionals in facilities that are appropriate. We very much turn to provinces, territories, and those actually do this for a living to scale up at a pace that is reasonable, that is appropriate for the quantities we expect to receive.
Thank you very much. We'll now turn back to the phone for one question and then to the room for one question. Operator, next question.
Yes, hi. Can you hear me?
Yes, we can.
Okay. I know some of this ground I'm going to ask about was covered yesterday, but I think it merits further clarification or such. Regarding the issue of, the elderly, especially those in long-term care homes, what contingency plans are in place to ensure those in long-term care homes are eligible or can receive the Pfizer vaccine among this first limited batch? Or
Dr. Maybe I'll start and then pass it over to Major General Fortin. So yes, we certainly appreciate the sort of unique requirements for the Pfizer vaccine. We also recognize that the long-term care, both the residents and personnel working in those facilities are one of the priority populations for vaccination. So taking that into account, and certainly the final decision in terms of the resident staff in their long-term care facilities, and as Major General Fortin has indicated, discussions are ongoing to make the sort of the initial points of use, the Delta sort of be a bridge, so that there are actually those types of settings in which the vaccinations can be given. Major General?
Yeah, I don't really have anything else to add to this. I think it's mostly public health, the public health aspect of that readiness.
Thank you. Follow up?
No, that's it.
Thank you. We'll go back to
campaign coverage goal, whether or not you have an idea of what the exact percentage is for herd immunity. What is the goal of coverage of Canadians you want vaccinated for this campaign?
Thank you very much for the question. I would say that the overall goal is really to vaccinate as many Canadians as possible, as quickly as possible. Certainly, we recognize, around the world, but here in Canada as well, the morbidity and mortality across all age groups. No one has immunity. It's a novel virus and certainly a pandemic without precedent. So I think that's our overall goal: vaccinate as many Canadians as possible, as quickly as possible. But with that, we recognize that we have work ahead of us in terms of, I would say, reinforcing Canadians' confidence in vaccines. I think the first good step, of course, is Canadians understanding that we have one of the best regulatory systems in the world. They've gone through their due diligence, and I think that Canadians can rest assured that the first vaccine that's been approved, the qualities, sort of ways to pass information, provide tools to our frontline healthcare providers to accept the vaccines are going to be offered.
So that's not a goal, that's a wish, that's hope. That's a hope is not a strategy, I'm always told. But anyway, and the other thing I want to know is, General Fortin, can you talk about the, sorry, to Canada, do they transship on Iceland or, Greenland? Where are they going? How come it's taking 36 hours? Do they use their own planes? Are they on a FedEx plane or are they on an Air Canada? Like, what's the actual?
I can tell you what we observed with the dry run. And it's up to Pfizer to really, with their third-party logistics, they deal with UPS. So it's entirely possible that it changes somewhat as we go forward. But UPS, 2 points of arrival in Canada by air, and then further distribution by road to different locations. There may have been a mix of air and road here, but it's
time though. We're getting very close to 2 p.m. So please keep your questions and your responses.
Votre ligne est ouverte. Please go ahead.
Thanks very much. Dr. Sharma, sorry to come back to vaccines, but here's the question. I'm a geek too, and I'm excited, but I think the question is about the 2 allergic reactions in the UK, or about the 2 NHS workers who had a reaction. They were in the wild. It was not part of the pilots, an RNA. Is it likely that people are allergic to RNA, or is it more likely people are allergic to the non-medicinal agreements, the phosphate dihydrate, the potassium phosphate, the potassium chloride? Can you give us a sense of where, in Health Canada's knowledge, we're
question. So in terms of the vaccine, you're right. So the components are proteins, an mRNA molecule is a protein. You can be allergic to them. Actually, most of the allergies are to protein, so it is possible. But you're right. More often than not with vaccines, is trying to do what we call root cause analysis. First of all, is an allergic reaction due to the vaccine, or could it be due to something else? With respect to the 2 individuals in the UK, they had a history of severe allergic reactions and have an alternative vaccine. So I think we're in the process of looking at that, but technically you can be allergic to almost any molecular substance.
Thank you. Follow up.
Thanks very much. So just want to come back to something Major Fortin said, one priority, and your quote was, I think we get that. In other words, Quebec is going to be able to vaccinate people who cannot move. So I'm looking to get a sense of, for residents of long-term care facilities who cannot be moved or it's difficult to move them, is there a plan in place for those provinces that want to inoculate LTC residents first or even in the second group? Is it possible to put it in the home rather than have a long-term care facility residents come to the point-of-use facility?
Yeah, as Major General Fortin, I can tell you that there's a couple of hundred points of use that are anticipated with the Pfizer vaccine. Those are the locations that they announced today or last night. They're hospital centers, long-term care facilities, but that's a significant size. How they execute the vaccination, whether they bring healthcare workers and those that have no mobility issues.
Move back to the room. Prochaine question, Radio-Canada.
Oui, bonjour, Laurence Martin de...
Hello, this is Laurence Martin, Radio-Canada. I know that a report was issued, and perhaps Dr. Newer or Major General Fortin could explain how many Canadians will be vaccinated in over the last few weeks. You said there are so many things we cannot control. The situation is fluid, and now we've got figures.
Okay, merci.
Answer. Thank you for the question. I can start by saying that we expect 6 million doses of vaccines for the first quarter, which means 3 million Canadians. But the Moderna vaccine will also be approved at some point. Apart from that, things remain fluid because we're still looking at the other vaccines that have not yet been approved. And if we are optimistic, as several million Canadians, I cannot say more than that because the situation remains fluid and continues to evolve. Perhaps Ariana Reza has a few words to add as to the contracts. There's Assistant Deputy Minister, and perhaps Major General Fortin. Unfortunately, the sound is not sufficient to allow for proper interpretation. The information is inaudible to the interpreter in the booth.
Alors, c'est un estimat. Merci.
Comment inaudible? Sorry. Question. We've seen you at these press conferences since the beginning of 2020. You have announced many terrible things to us, and how do you feel to stick? I think really this is a light at the end of the tunnel, but we also have to stay patient. Even though there will be other vaccines that will be approved soon, but we cannot lose track of the importance of maintaining these public health measures in place for now. Before we have a large proportion of Canadians vaccinated, we need to maintain these public health measures. To tell you honestly, it's going to be a tough winter. I think people throughout the country have to think that it's important to maintain all public health measures in place over the wintertime. And in the first quarter, we will start vaccinating more.
Merci. Our last question, la dernière question, Adam Miller, CBC News. Your line is open. À vous la parole.
Hi, thanks very much for taking my question. You know, we've talked a lot about logistics and rollout, but one thing you said, Dr. New, was a key part was reinforcing Canadians' confidence in vaccines going forward. You know, is public health messaging a key part of that? And is it a concern of yours that, you know, there are going to be people, you know, at some point in the rollout who may not want to get a vaccine, and how are we going to instill confidence in these vaccines going forward?
That's a good question. Thank you very much. I would say that in terms of vaccine confidence, it's something obviously we've recognized and dealt with as an issue even before COVID-19. Certainly the lessons learned in terms of how we give credible information, what are the issues that Canadians are concerned about, and how we can best address them with giving them credible information from trusted information sources. Those are all of the things that we're looking at. Obviously, it was pre-COVID-19, but obviously it's also very important right now. Not to get into all of the details, but we have lots of folks working on this issue. Certainly, we'll be rolling out, I imagine, in very much.
Thank you. Follow-up.
Just wondering how big of an issue you think vaccine hesitancy will be, you know, in this rollout plan, and at what point? I mean, we're talking about April to July to maybe December for the average Canadian, but is this an issue that you foresee in the near future, or is it something, you know, you don't think is going to be as big of an issue in the next few months?
I think it's an important issue all the time, and certainly as we start to roll out the vaccine, I think, you know, testimonials of people saying, hey, I got the vaccine, it was good, I'm glad to do it, it protects me, it protects my loved ones. I think it's important for everyone to make an informed choice. I think the momentum will grow with time as we offer the vaccines to more and more Canadians. So I think, yes, that'll be part of it. And of course, as I said before, the outstanding questions, I think people do have questions about the fact that, you know, the vaccines that were developed so quickly, you know, how does this relate to maybe other vaccines and so on? We recognize those are all very live issues. I think it's, a testament to modern science and great global collaboration that I take up the offer to get vaccinated. And as I said many times, the first step obviously was showing Canadians that with the due diligence, our regulatory colleagues approved the first vaccine, and we I expect them to do the same thing with any other vaccine candidates that put a submission forward to them.
Thank you, Doctor. Very last question for today, CBC.
Major General, can I just ask you how delicate this vaccine is when you crack open the cases and you look at the monitors? If it's gone above a certain temperature.
So I don't have a clear answer on the estimate, but what I do know is that the reader, such as this one here, will give you an indication that there was something incorrect with the temperature, the fluctuation of the temperature, and then we'll turn to the proper actions will be taken.
Follow up microphone, please.
I don't know.
Dr. Sharma?
Yeah, so these are mRNA vaccines, so they are delicate in the sense that, and that's where there's it's called lyophilization. There's fat lipids that are put around it to kind of buffer that. The issue is that in its frozen form, it needs to be kept between -60 and -80 degrees Celsius. And so if it goes either too hot or too cold, then there might be a chance that mRNA might break down. And then you don't have as much surety both on the efficacy side in terms of how the vaccine will work and on the safety side. It's unlikely that it would make that much of a difference, but it really is, these are the conditions.
For how much you might lose?
Well, it's really around the handling, right? So the hope is that you don't have any. But in terms of when you're doing the planning for rollout, in general, if you look at how the vaccine is then taken out, thawed, used, and you might have, that's in all of the handling of the vaccine.
Thank you very much. That will be all for today's press conference. C'est ce qui met fin à la conférence de presse pour aujourd'hui. Bonne journée.